Hey everyone, it's Dr. Sunita Punjabi, your brain coach. We are taking this month, and this is May, Mental Health Awareness Month, and we're really going to go aggressively after dispelling myths. I think I said that right. Myth. Anyway, one of the most common myths that we have is that having a mental illness diagnosis means that you're crazy. I really think this is an important one. Couple of reasons. What we're seeing in the world right now, the stress, the economy, no COVID, yes COVID, the rise in the numbers, the down in the numbers, all of this instability is really pushing people to levels of stress that we've never seen before. The use of prescription medication for anxiety and depression is at an all-time high. Well, what does that mean? That means that most people or more people are experiencing some type of mental illness than ever before in our history. And now that I'm glad that awareness is coming up and people are understanding the symptoms more. But I really want, for those of you that feel that you have symptoms or you're struggling with anxiety or depression, or it could be a lot of things. You could have heart palpitations, and that's an indication of something else. You could have self-consciousness, exaggerated thoughts of death. That's pretty common right now too. You might find that you're focusing on negative things. You might find that you're addicted to watching the news. The brain does that because it's looking for an answer because of all the uncertainty out there. Whatever is causing it, if you have symptoms, first thing, let me say about mental illness, it is just like breaking your arm or your leg, but you can't see it. It is a real illness. But because it's inside this wonderful thing called your skull, you can't tell. It doesn't bleed necessarily. It doesn't look like what we know a physical illness to look like, but it's real and it is physical. And I wanted to talk about that a little bit. When the brain experiences any level of extended stress, anxiety, depression, triggering factors, all of this changes the chemistry of the brain. Eventually, with enough stress on the brain actually says, I'm out. And it changes. It physically changes. So you can actually see neurons beginning to fire a different direction. You will see neurotransmitters, which are brain hormones. They're going to start changing. You'll see increased levels of certain neurotransmitters and decreased levels of dopamine, for example, is an indicator. So when we have these changing levels and we have new highways that are being formed in the brain, you have a diagnosable physical change to your body chemistry and function, your brain chemistry and function. So it is a real issue. Just because it doesn't look like a broken leg or a broken arm, it is as real and maybe more real. In fact, what we find is that mental health is health. Let's think about that a little bit. What does that mean? See, if your brain isn't right, if your thinking isn't right, you're not going to have the capacity to take care of other things that are physically wrong with you. So if your brain goes or it's not functioning well, you won't even know that you're ill in other areas. You won't recognize heart problems. You won't recognize respiratory problems. So the brain is ultimately the engine. It's the driver, right, of your body. And when it's not functioning well, everything else is going to be affected and you don't have the proper thinking, you can't really make decisions about your physical well-being, the rest of your body, effectively if your brain isn't well. A lot of people go to the gym, they work out their arms and legs, but what about working out our brains? Just like the rest of your body, it needs to stay tuned, it needs to be fed, it needs to rest, it needs to be exercised. So learn more about exercising your brain in the upcoming videos. This is your brain coach signing out.